I always thought one of the things that I'm missing in my trauma training is that I've never been deployed to a war zone. Sadly, I don't have to be deployed to see devastating high-velocity firearm injuries. That's really tragic because America, it is thought of as the dreamland. The things that we're seeing, the epidemic of mass shooting, shouldn't happen in this country. I'm Lillian Liao. I am a trauma surgeon and the pediatric trauma medical director at University Hospital. The Level 1 Trauma Center takes care of the most seriously injured, people who are very badly hurt. Our job is to save their lives.
Another mass shooting. It didn't happen in a big city like Orlando or Las Vegas. The targets this time were worshipers in their small town church.
November 5th, it was around noontime when all of our pages went off and we were notified that a mass shooting had occurred in Sutherland Springs, Texas. When you get a page like that, the notification only says a shooting has occurred at a church, more to follow. That means that first responders, the police, hasn't even gotten to clear the scene to bring patients to us. So they have no idea how many patients are going to come. Usually in this types of situations, most people don't survive the shooting. They're dead on scene. We had no idea how many victims would come through. Because it was a church and the shooting occurred when most of these people were sitting down, a lot of the injuries came across the pelvis. People who actually were hit any higher up were the ones that didn't survive because the potential for hitting organs that bled more quickly. I have never seen that many injured patients by high velocity weapons all at once. Different firearms cause different types of injury when they hit the body. What we see here in this country are really wounds from a handgun. And those create a small hole. An assault rifle type injury, the speed of the bullet creates the ability to penetrate the body and destroy tissue in a way that a handgun cannot. If it hits a person in their abdomen, it could take out all of their intestine, the blood vessels, your kidney, and bones. Those people who survive these type of injuries have areas of tissue missing that we can't replace. What you see in video games or television shows don't really give you the sense of magnitude of tissue destruction. Things are so broken that you don't recognize the body parts that they're supposed to look like. This is when putting Humpty Dumpty back together becomes really challenging. The injuries that the patient sustained were so severe that I never thought about my own emotions. My thoughts were planning out the next day, the surgeries that needed to happen the next day. Those patients have to go home. They have to go home because their family needs them to go home and their community needs them to go home. You have one goal.
your goal is to save that life. Because if you can't, then you have to have that horrible conversation with the family. And it's a conversation that, while we have too often as trauma surgeons, you never want to have another one. While it is horribly tragic that we lost a patient, the other side of it was that every few weeks we were able to send another patient home. Their lives will never be normal. They're going home, but they're going home completely different than the day they walked into church. No amount of specialty training in surgery or medicine can fix that. When Parkland happened, we all thought, gosh, it hasn't even been 6 months.
17 people shot to death today at a high school in Parkland, Florida.
I think it's important for all of us on both sides of the bridge to understand and be educated on it. It is important for everyone to see how high-velocity firearms can injure a person unnecessarily. I do think that if we can come to common ground, that we could get further together as a community. Everyone believes that we should not have another mass shooting, and that this particular epidemic has to stop. And how to stop that is the challenge. I know that there are things I can do to build resilience within our community to save lives. The Stop the Bleed initiative was developed in order to build resilience of bystanders, because bystanders are always first on scene. So it is important to develop a national trauma system where every region of the country could potentially be prepared for a devastating event such as Sandy Hook, Sutherland Springs, Las Vegas, because it will happen. It's just a matter of when.